Welcome back. When it comes to the dangers of vaping, there's one thing many people may be overlooking, and that's flavor. Dr. Andrew Stiehm, a pulmonologist with Allina Health, joins us tonight to explain why he considers flavored vaping cartridges a major threat. Welcome back.
Thank you.
We've actually seen this in the news when it comes to cities, towns changing some of their laws, specifically trying to ban flavored vaping products. What is the big concern when it comes to these flavored vaping cartridges?
Well, I don't know if you remember the first time you had coffee. It doesn't taste good
No,
the first time you had coffee,
nope.
but add enough sugar, add enough cream, and it becomes very palatable.
Yes.
The same thing is true of vaping. You know, the first time you try a cigarette or vaping, it doesn't taste good, but add some cotton candy, add some mint, and some fruit, it becomes much more appealing and appetizing, and it attracts people to doing it.
And especially when you're of a young age, if I see those flavors, it might be something that I'm going to, if I like candy, right?
Absolutely. I mean, there's Skittles flavoring to vaping products. And that really punctuates the point. 10% of our middle school students in a recent study are vaping. I mean, this is a problem that is targeting our young children.
And for we know that's just the ones that are admittedly saying so, that they're doing it. Well, is vaping more dangerous than smoking cigarettes? Some people might say there's some health benefits to transitioning from smoking to vaping, but how would you describe that?
I think it's a little bit of a false dilemma. It's kind of like saying, would I rather play Russian roulette with 3 bullets or 1? I'd rather not play Russian roulette at all. But if you compare the health hazards of smoking to vaping, it does look like vaping is probably less dangerous than smoking.
And what about the dangers that are still there that people should be worrying about? I mean, might they still have certain symptoms? Like, it's not that if I'm just vaping, I'm never going to have to deal with issues in my lungs or in my throat, correct? Right.
If you count the number of cancer-causing agents in vaping aerosolized product, there are a number of cancer-causing agents there. So it probably will at some point in the future be shown to cause an increased risk of cancer. But far more common are acute health effects like cough, bronchitis, oral sores, irritation in the mouth and nose. And we've all heard about this vaping lung injury that's putting our kids in the ICUs and even dying.
And is there something that was specific to how those lung injuries were happening? It happened so fast, so swift, and it maybe tapered back a bit. Was there something in particular that was maybe leading to those hospital stays and severe lung injuries?
It really looks like it's something we call vitamin E acetate, which is something used to cut the vaping solution. So you need to turn something into a liquid state so that you can aerosolize it. And vitamin E acetate is commonly added to turn something into a liquid.
One thing we've heard of people saying is through vaping, they've been able to quit smoking, but maybe they never truly quit in general. Is that correct? Because now they're just hooked on the vaping product?
That was one of our bigger studies that did show that smokers who started vaping were able to stop smoking, but they continued to be vapors. So they continued to be addicted to a nicotine product.
So at the end of the day, there's still that consumption happening, but the concern that we just want to discuss further again is the flavors and how they might be attracted specifically to children.
Yes.
Okay. Well, Dr. Stiehm, thank you so much for coming on and explaining some of these concerns. So hopefully if there's parents out there, they're listening and then taking precaution with what you've told us. I appreciate you coming on today.
Anytime.
You got it. All right, for more on the vaping epidemic, just visit WCCO.com.